remarks in response to the Long-Term Care Commission report. We'll have a couple of questions from the floor and then go to the phone line. So now is the time to press star one if you haven't already.
Thank you, and good morning. I'm here today to respond to the final report of Ontario's Long-Term Care COVID-19 Commission. Our government launched the Long-Term Care COVID-19 Commission in July 2020. Their stories, experiences, and expertise with the Commission. To everyone impacted by this tragedy, especially to long-term care staff, residents, and their families, our government hears you, and we will do right by you. I have reviewed the final recommendations, and I will speak to some of them today. Many of them are in line with measures our government has already begun and is underway, urgently implementing our staffing plan, investing in stronger IPAC measures in homes, and developing thousands of new long-term care spaces. We are investing historic amounts to make good on our commitment to repair and rebuild capacity in long-term care homes. We have over 20,000 new and over 15,000 upgraded spaces in development, more than 60% of our goal of creating 30,000 new spaces in a decade. And overall, our government is investing more than $9.6 billion, new dollars, in response to the pandemic to shore up staffing and modernize our long-term care homes. Many of the recommendations require further investigation, and I will be providing regular public updates on our progress. The report recommends offering counseling to all residents and staff, and I would urge every long-term care operator to do this immediately. The commissioners are right in identifying the trauma experienced by residents and staff, and those residents and staff need support. The commissioners recommend separating the development of long-term care homes from their operation, and I've spoken to operators and developers who are interested in pursuing this type of model, and there are many positives with very few negatives. This is an interesting model, and the ministry will continue to explore it. The report recommends accelerating the implementation of our government's historic staffing plan. We are making progress and expanding the pipeline to get more staff into homes where we know they are sorely needed. For example, the training programs that we're investing in through Ontario's public colleges, private career colleges, and school boards will graduate up to 16,000 new PSWs in the next year, more than 2.5 times pre-pandemic levels. There are thousands of students in the classroom and on clinical placements as I speak. Fixing this problem will take many solutions, and we know that there's a lot more to be done, and we're going to keep doing it. I'm committed to making long-term care a better place for staff to work and a better place for residents to live. We need to improve conditions for staff in long-term care and for residents. PSWs are the backbone of long-term care homes, and through programs like pandemic pay and the temporary wage enhancement, we've shown we have PSWs back. With pandemic pay alone, we saw results, and homes were able to hire more than 8,600 new staff members. The staffing study found it. The staffing plan acknowledged it, and we all know it. Wages and working conditions matter. We need to ensure that we attract and keep workers in the sector, and we fully acknowledge that more needs to be done. And with the Commission's final report to inform us, we're going to move forward on these issues. Improving inspections is a recommendation made by both the Commissioners and by the Auditor General in her report last week. And I want Ontarians to know that we are actively working on changes to the inspection regime. The report makes it clear that the lessons learned from SARS were forgotten or not implemented in the long-term care sector. The report also makes it clear that the long-standing issues neglected by successive governments contributed to the spread of COVID-19. Issues like overcrowding and homes built to old design standards, chronic understaffing, and a lack of adequate preparedness. The Commission's insights will help us move forward and ensure that history does not repeat itself. There is no question that residents and staff at long-term care homes and their families were disproportionately impacted by COVID-19. And as I said in my testimony to the Commission, we cannot let their experience be in vain, and we will not let their experiences be in vain. Since the Commission started its work, the situation in long-term care homes has dramatically improved as the province ensured that residents and staff were first in line for vaccines. And as a result, the number of cases, outbreaks, and tragic deaths have all fallen considerably. And this is why I anticipate changes coming later this week that will improve residents' quality of life and address their emotional well-being. However, despite the impact of the vaccine, it is important that we remain vigilant. We will continue to work with our partners across the sector to address the Commission's recommendations as we continue to build a safe and modern long-term care sector that respects the dignity of our seniors and the staff that care for them. Thank you.
Okay, we're going to start with a question from the floor. That's me. Hi, Minister. Jessica Smith-Cross here. The report finds that some residents died not of COVID-19, but of neglect and dehydration. They learned that from several sources, including the Canadian Armed Forces. They found one CF member noted that in one of the homes they entered, 26 people had died from neglect and dehydration when, quote, all they needed was water and a wipe down. When did you first learn that people were dying from neglect?
Well, I think that if we, first of all, let me acknowledge the importance of the military and how grateful I am to the Canadian Armed Forces for their help. Yeah, really, if you look back at the homes that were struggling, at the beginning of the week, they could be fine. But as COVID hit, by the end of the week, it could be a war zone. And certainly that's the way it was described by staff and people on the ground in those homes that were under siege by COVID-19. So if we look at the Commission's recommendations about the staffing levels, about having surge capacity for staffing, to really prevent and be preemptive so that we do have adequate staffing, I think those recommendations are very, very helpful and very insightful. And so that is exactly what we're doing, is creating the staffing capacity that is required to address any situation, unfortunately, like what happened with COVID. Excuse me. It is devastating. As a doctor, I've spent decades helping people and being there in their time of need. And so, this virus, it has been collectively devastating, including for residents and staff and family members and everyone who's been working around the clock to alleviate the pressures on long-term care. But we have to move forward. We have to move forward. And I came to politics because of long-term care, the neglect of this sector, and I came to fix it. Our government is fixing it. And we will move forward, understanding the insights and the recommendations from the Commission. And I'm very, very grateful to the Commission for this work.
My follow-up question, I will just first point out you didn't answer the question. When did you learn that residents were dying of neglect? And to combine with my follow-up, since I only get one, you said in the fall that the first wave of COVID was comparable to a bad flu year in terms of the number of deaths in long-term care. Do you regret that statement now, given the horrors described in this report, including the deaths from neglect and dehydration?
Well, I appreciate the opportunity to clarify that. I never did compare COVID-19 to the flu. That was not a comparison. What I was suggesting at the time is, we have to improve long-term care. Deaths in long-term care due to infections and outbreaks have been going on for many years, and I certainly would have to refute that statement. As I said, I've come to long-term care with compassion and, not only bringing years of experience behind me, but also a passion for this area. I've gone through it personally with family members, including one of my parents. So I think we should all collectively want to make this better, and why it's taken a pandemic to reach this point. I can't quite understand. So I know I'm fixing this problem. Our government is fixing this problem. And, my heart goes out to everyone who's been impacted. This was a war in our long-term care homes, and our long-term care homes were on the front line. So, collectively, we can all make a difference. And people's lives must not have been lost in vain. This must be the tipping point. And why it took so long. Years. So we have to move forward, and looking at our capacity building, looking at the staffing, looking at the infection prevention and control measures, looking at the well-being, the emotional well-being and the psychological well-being of seniors in long-term care. All of these things need to be addressed, and that's exactly what we're going to do.
Over to the phone lines.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Minister. Can you hear me?
Yes, I can.
Minister, given the specific comments in the Long-Term Care Commission's report about the speed of the government's response in the first wave, what do you wish you had done differently back in February, March, April of last year?
Well, I think the government measures and processes, we were trying to move fast for government. And COVID-19 was moving faster. And I think lessons learned from the first wave applied into the second wave in terms of our improvement in staffing, the 8,600 plus the hires into long-term care over that time were very, very helpful. But that was not enough. Obviously, the second wave was very much about community spread. The magnitude and the duration of wave 2 was just so much greater. And our ability to keep up with that in terms of government speed, obviously it needs to be addressed over time, and what processes that we can put in place to have government move faster. But it really is. It's about integrating all the various partners: Public Health Ontario, Ontario Health, the local health integration networks, the advice from the various tables, the various ministries involved. All of that level of coordination takes time. And it just wasn't a match for the speed of COVID-19, and so we have to understand our processes. I think that there are many, many lessons learned from Wave 1, lessons learned from Wave 2, and there'll be lessons learned from Wave 3. And this speaks to the veracity of COVID-19 and how it can change, and our different measures needed for different times.
Are you or your government going to apologize to people for what happened in long-term care?
I think collectively as a society we need to do some soul searching and understand why, it took a pandemic to address the capacity issues in long-term care, the staffing issues in long-term care. Our government, and as a Ministry of Long-Term Care, we had started urgently as soon as we became a ministry to address that, the wait lists. And so it's very, very clear in the Commission report and the Auditor General report that these were long-standing issues. But the responsibility has fallen to our government. And as I've said several times before, I came to government. I ran for a political office because I kept saying, why isn't anyone doing something about long-term care? We have an aging population. We have so much more complexity in residence, and the Commission talks about that. And so, I think that the responsibility has fallen to this government, to me as the Ministry of Long-Term Care, and I absolutely take responsibility for the well-being of residents in long-term care and staff, and along with all the other entities that have been working round the clock to address this 100-year pandemic against an unknown virus. So absolutely, that's why I came to politics. I did not expect a devastating COVID-19 type virus. Certainly we were overdue for a pandemic. If you look at the capacity issues, the staffing issues, and the IPAC issues, those three things that hadn't been addressed for many, many, many years, really were looked upon by the Commission and addressed by the Commission. And they've made very, very insightful recommendations. And we're going to move forward with those recommendations, many of them. And we'll have to have a careful review to see what can be done now, what can be done over time. But clearly the staffing, and if we look at the staffing alone, many of these things, go back to the inadequate staffing that was a crisis for many years. And our government has 16,000 staff that are in the system now, and that's for training and to be available to homes as we grow the capacity and address the staffing crisis that was pre-existing. That's 10,000 more staff than the previous years. So this is unprecedented in terms of our response, and historic investments that have never been made in the history of this sector. So I look back and I say, why did it take so long? So many years went by and without addressing long-term care when we knew there was an aging population. And our government is addressing it. Our government is taking responsibility. It's our government that has a plan for this after so many years of neglect by previous governments. Why didn't they do anything? I can't answer for them.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Minister. You've talked about making wages or making working conditions better. So when can people in working in long-term care expect better wages?
Well, that's part of the recommendations by the Commissioner. They talk about, leveling the playing field. Those are my words, not theirs, but that's paraphrasing. Looking at the parity amongst the different levels of healthcare and understanding how we balance that. The healthcare system, including long-term care, is a complex system, and if you touch one area, something else can happen in another area, and you don't necessarily recognize it at the time. So we have to be very thoughtful about how we approach this. But we began already with the pandemic pay, the temporary wage enhancement, which we've brought up to date again and extended that. And we're looking at ways not only through the numbers of staffing to help our staff in long-term care, because you reach a critical level and the burden begins to be too heavy for the staff that are in the home. So clearly it's staffing numbers, but it's the training, it's the IPAC training, it's the leadership, it's the transparency and the accountability of the homes, and the ability for families of residents and residents to have that information available to them. It's about communication with families and residents. And so we'll be looking at all the different ways that we can improve based on the recommendations by the Commission.
Last question. So I didn't really hear an answer there. So what do you want people who work in long-term care and are thinking of getting out, leaving the system in further crisis. What kind of message are you sending them with an answer like that? You didn't answer the question.
Well, I would disagree with you. I reiterated what we've done through this process, that we're taking the recommendations by the Commission in terms of the parity and leveling the field. We want PSWs to be supported. They are the backbone of long-term care. And this whole sector, including the staff, has been neglected for many, many years. And the Commission report, the Auditor General report, is very clear on that. The responsibility is falling to our government and to me as the Minister of Long-Term Care to make this right. Those lives in long-term care that were lost, I'll repeat, they must not be lost in vain. And our government is making sure that we will do right by the residents, by the staff, and by the people that have experienced such devastation. Well, we are fixing a broken system. And for our PSWs, I know that I've been in touch many times with Ontario Personal Support Worker Association, and I know that we will do everything possible to make sure that they receive the support that they need and deserve. And we'll continue to modernize the long-term care sector that was neglected for so many previous years. And the Commission is very clear about that. And again, I want to say I'm grateful to the Commission for what they have provided as a guide, and we will move forward. So appreciate everyone's interest. Thank you.
Minister, can you stay a little longer? There are more reporters on the phone line, and this is a very important issue. Give any more time.
And we have questions from the floor, Minister. We have 2 questions from the floor, and we have people on the line that would like to ask more questions. I'm wondering why you're running out.